三藩市美亞醫療集團擁有超過170位華人專科醫生同會員服務團隊，用你最熟悉嘅語言，為你提供貼心周到嘅醫療服務。免費登記成為我們嘅會員啦！美亞醫療，你嘅健康良伴。
Are you at risk for type 2 diabetes? In this scenario, you'll learn about how type 2 diabetes affect a person's body, the differences between type 1 and type 2 diabetes, and how uncontrolled type 2 diabetes increase the risk and symptoms.
Adam is home with his grandmother. She is 70 years old. Lately, she's been feeling tired and eating lots of snacks.
Grandma, you should be careful not to eat so many cookies. The doctor said you've been gaining weight.
I can't help it. For some reason, I get very hungry soon after a regular meal and also feel tired.
You're feeling very hungry and tired? I think we should go see the doctor about this.
Adam takes his grandmother to the doctor's office the next day to take some tests. She explains her symptoms to the doctor. In addition to feeling hungry and tired, Adam's grandmother says she also gets thirsty and goes to the bathroom often. The doctor discusses the results of the tests.
Blood glucose, 156 milligrams per deciliter. A1C, 7%. Based on these readings and the symptoms you've described, my diagnosis is that you have type 2 diabetes.
If she has diabetes, that means she has high blood sugar, right?
That's right. Blood sugar levels are normally less than 100 milligrams per deciliter after not eating for at least 8 hours, or less than 140 milligrams per deciliter 2 hours after eating. Her body has become insulin resistant, meaning her insulin isn't working properly. She may be eating a lot, but the glucose from the food that she eats isn't being converted into energy.
Sorry, doctor, I'm a little confused. Can you explain to me about how glucose and insulin work?
I'll try to explain it as clearly as possible. Glucose is a simple sugar, and comes from the food that we eat. When the stomach digests food, the carbohydrate in the food breaks down into glucose, which is used for energy or stored in your body to be used later. The glucose is released into your bloodstream, so naturally, your blood glucose level rises. In response, the pancreas releases insulin, which is a hormone that signals the cells of the organs to allow the glucose to enter. This is how normal blood glucose levels are maintained. However, since you have type 2 diabetes, the cells have a reduced response to insulin, and cannot easily store or use glucose. The pancreas tries to make up for this by releasing more insulin, but becomes exhausted. The insulin is produced at a much slower rate than before, and does not work as efficiently either. Because the glucose cannot enter the cells easily, a high amount of glucose remains in the bloodstream and your blood sugar level increases very high.
What happens when I have too much blood sugar?
Imagine your bloodstream as a traffic highway, and your glucose as cars. In a healthy body, this highway has cars drive through and exit it without any problems. The flow of traffic is steady. But in type 2, your bloodstream is like a highway filling with cars. More of them enter faster than they can exit, causing traffic to become congested. In other words, the glucose can't work efficiently to become energy for your muscles and other organs. Because your body isn't getting energy, you experience these symptoms.
I think I understand now.
So what is the difference between type 1 and type 2 diabetes?
Think of insulin as a key, and the receptor as a lock. The insulin is the key that unlocks the receptor lock, and opens the door of the cell, allowing the glucose to enter. This is how a healthy body responds to the glucose and insulin. In a body with type 1, there is no key to unlock the lock, so the glucose are locked out of the cell. On the other hand, in a body with type 2, the lock to the door malfunctions or the key doesn't work properly. This prevents the glucose from entering the cell efficiently. As a result, you feel hungry very quickly and may overeat, which then leads to weight gain. Several lifestyle factors such as physical inactivity may also contribute to weight gain.
Oh, I see. So because the body of a person with type 1 isn't able to make insulin anymore, it needs insulin injection. And for type 2, the pancreas can still make insulin, but it doesn't work very well, so it takes longer to move the glucose.
Yes, exactly. Also, while type 1 diabetes occurs often in children and young adults, type 2 is more commonly diagnosed in middle-aged adults or older. Luckily, you came to me about your grandmother's symptoms before the condition could have become more severe. If you don't manage your diabetes, you are at risk for long-term complications such as blindness, heart attack, nerve damage, or stroke. What you eat can have a big impact on your blood sugar. I will refer you to a dietitian. She is a certified diabetes educator. Work with her on your lifestyle changes to manage your diabetes. I will follow up with you again next month.
Thank you, doctor.
For more information about diabetes and other health topics, please visit the AAMG Health Education website.